Hi, I'm Dr. Hosek.
I'm Brittney.
Welcome to the March edition of our video newsletter. This month we're concentrating on internal parasites.
Yes.
Heartworms and intestinal worms are the ones that we see. And what we found is when we were doing seasonal preventatives, a lot of these patients were coming back with intestinal worms the next spring.
Yep, the next one.
So what we discovered is that we have days above freezing every month of the year. We had 20 below in January, then it was 50 above a few days later. That's when your pets are going to be exposed to intestinal parasites. So it's really important to do year-round protection.
Mm-hmm.
We've got several products that we use. I think we'll put up a picture of that here that shows the different products that we have. We've got oral products, topical, and injectable. So between them, we got every pet covered, every situation. We also wanted to just talk about how important it is not only to keep our pets from getting these diseases, but they can be spread to people too, right?
Yeah. I mean, they just live in the ground, so if a kid goes outside barefoot, they can get like hookworms or something.
Right. Or kids like to eat sand, they could be exposed to roundworms that way and can cause some really serious problems.
And then people don't realize, like, cats get intestinal parasites too, and sandboxes are big litter boxes for cats, so their kid goes and plays with it.
Right.
And get yuckies.
And then one of the things I want you to talk about in our Ask Our Vets, we had a question, if my vet took a blood sample, why do I have to bring a stool sample to check for heartworms? Heartworms live in the heart.
Yeah.
So the blood sample's looking for the heartworms, the stool sample's looking for the intestinal parasites. So we've got some pictures here. This is you running, I think, a stool sample.
Yep.
So basically we're looking for the worm eggs.
Mm-hmm.
Okay. And we find those still in animals that haven't been taking their preventative year-round, or sometimes there's resistant parasites.
Yep.
The nice thing about the preventatives that we use, if you're using them year-round, your pet ends up getting worms, the company will pay to treat them.
Yeah.
You don't have to pay anything. So that's really important going forward, that you're doing that year-round protection. We've got these days of the year. The preventatives work backwards for the once-a-month ones. For the injectable one, it actually works forwards.
That's
6 months.
It goes on for 6 months.
Does the heartworms and a bunch of intestinal worms too. And the parasites, they're just out there. They're always going to be there. We're never going to get rid of them, but we can do our best to keep the pets from getting them.
Yep.
Also, this month, instead of Pet of the Month, we have a sad bit of thing here, but we wish to let people know we're looking for a lost dog, and this is your dog.
Yep.
Yeah.
We're looking for Santino. He got out in January when it was really that 30 below degree day.
Yeah.
My fence froze open, and so him and my other dog got out. Luckily, I was able to get the little guy, and unfortunately, Santino's legs are longer, so he got
He was
further.
enjoying his freedom.
He was enjoying the snow, which usually that'll be okay, but he does suffer from seizures and needs twice daily medications.
Okay, so we're thinking somebody probably took him in, didn't know he belonged to somebody. We're hoping that someone will see this video or our Facebook post and let us know if they see him. But we're definitely hopeful that he's still around. But he does need his medication and his preventatives, especially his intestinal parasite preventatives.
He always gets worms because he eats everything.
And he likes to carry things around his mouth, you said.
Yes.
And despite being a Doberman, friendliest dog you're ever going to meet.
He loves everybody, people, adults, kids, dogs, cats, squirrels. Everyone is his friend. He picks up everything. He's like the neighborhood recycling man. He'll pick up a plastic bottle or a beer bottle and bring it to you. Yeah. So he loves fetch. If you throw something, he will bring it back.
Okay, well, we'll update you if we end up finding Santino, but please keep your eyes out. And then one more thing, I'm just going to give you a staff update. Dr. Martin, who's been with us for about 2 years, left in February.
Yep.
Moving on to bigger, better things, we hope. So I just want to let you know that between Dr. Sullivan and Dr. Antonici tonight, we've got the cases covered. And we are looking for another doctor because we are very busy here, so we want to make sure we're able to squeeze everybody in. But so far, it's been going pretty well.
Yep.
And we'll let you know when we hire somebody new. All right, that's it for this part. We'll move on to part 2. So if you'll stay tuned and watch that when you can, we'll see you then. Bye.
Bye.